Hi, everyone. I'm Dr. Traci, and today we're going to talk about the topic of self-disclosure within therapy. So this is one of those topics that is a discussion in ethics classes. And, there's not necessarily any sort of right or wrong to it, but the goal, it goes back to the main goal is you just want to make sure that any sort of self-disclosure that you do in therapy, and for those, just to make sure we're all on the same page, when I say self-disclosure, it's like sharing anything personal about yourself to the client. So when you're doing this, you just want to make sure that it is for the purposes of their treatment and it's for clinical reasons. So there's a wide range of thoughts about this. Usually therapists have a pretty good, solid belief system about this, where it's either like zero self-disclosure, or there's a lot of therapists that will, completely self-disclose quite a bit. I don't agree with this for a couple of reasons. And again, this goes back to how I was trained, especially in forensic psychology, but, and psychologists in general are trained a little bit differently than like master's level therapists, which is fine. But there is a difference. And we'll also talk about that a little bit later when we talk about how to start treatment and the process of therapy. So with self-disclosure, I come from the theoretical background for the therapist to kind of be what we call a blank slate, right? And we want the client to be able to almost project what they need us to be for them, so, and we can become that, which makes which helps them in turn with therapy. If they know a lot about us, for example, let's say somebody who is going through a divorce and you've never been divorced, or somebody's having marital problems and you've never been married, or kids is a big one. If somebody's talking about their kids and you're, advising them on kids, but yet you don't have kids and they know that could be a big issue. Any types of things like this with personal experience. What they don't realize is the reality of it is that we don't have to experience this stuff personally to be able to help them, right? Same thing with I know addiction is a big one. It's like, well, how would you understand? But there's also a benefit that the client doesn't realize, that if we're their goal is to not be in it. And that's where, if we haven't experienced, that's where we're coming from too, is on that other side of it. I hope I'm explaining that where that makes sense. Probably didn't explain that to the best of my ability, but hopefully you get the gist. Feel free to ask questions about that too, and I'm happy to clarify. So with self-disclosure, it's going to be very dependent on primarily the setting, right? If you're at an organization, you're going to have probably no self-disclosure. And this goes back to even having pictures in your office, any types of personal things where the client can kind of assume or get a feel of who you are, things like that. And because that can then make them have judgment towards us. Either way, it could be good or bad. But we want to kind of keep ourselves out of the therapy process, in a sense, and allow them to just do their own work. The other thing, then also, if it's maybe, so the more severe of a setting, I don't recommend any self-disclosure at all. And when they do ask you, and they'll come in and say, oh, how was your weekend? Oh, or if I had to call in sick or something like that, I would tell the front desk people, I would say, oh, don't say that I'm on vacation, or don't say that I'm sick, because, then when we come back, they want to know like where you went and how it was, or, oh, are you feeling better? Or, and even if it's something like grief, like, my dad passed away recently, and, I told my colleagues, like, don't say, don't tell anybody, because then all of a sudden the focus turns to me, and they want to know how I'm doing, or, or they could even cancel, and they say, oh, you need time to grieve, I just want to give you that time. And that's not what this is about. We're here for them. So we want to, be really careful with that kind of stuff. Then you want to also, in private practice, it can become safer and more appropriate to self-disclose a little bit. But keep in mind, when you do self-disclose, you want to make sure that it is for the client's benefit. And you don't want to go into a long story. Remember in the episode about top faux pas of, therapists in therapy is to, we don't want to be talking more than them. So sometimes I'll just give them a little bit, and that's it. We cannot, we don't want to seem as if we're having a hard time, right? Because then they're not going to self-disclose as much. They could be holding back, and then there could even be a trust factor that we can't really be there for them, and we can't handle it. So self-disclosure is something that you really, really want to think about. And I didn't start doing it until I have my own practice here. And even if I even had a practice that was in an office, in a separate office setting, I probably would still have very limited self-disclosure. But now that people are actually coming to my home, they know our animals, it's a much more personal experience. We have events and retreats, and, they're all, even though there are professional boundaries, they're like, they're very, it's just a more, what am I going to say, friendly, more open atmosphere. They, my husband's out there, they know my husband, and so it's much more casual setting here, so it lends itself to be able to self-disclose a little bit easier. But even then, you never want to take the focus off the client. I would love to hear what you feel about this in the comments, what you've been taught, what you've experienced. And if you're ever unsure, err on the side of caution and do not self-disclose. And another thing, you also don't want, you don't want the client to have judgments to that, to whatever you're disclosing, or to, make assumptions about you, or to later even use it against you, because it's not about us, it's about them. So if ever in doubt, don't do it until you are very comfortable and you have a good rapport and trust with the client, and you're in a setting to where it's appropriate. All right, hope this helps. Let me know what you think. Bye.